Welcome to Lecto. Today we are going to discuss vitamin C, which is also called ascorbic acid. So this is the last water soluble vitamin. In the previous lectures we have discussed all water soluble. So this is the last one. So first of all, we will discuss the different sources of the vitamin C. Whenever you listen the word vitamin C, then the different citrus fruits comes in your mind, like oranges, grapes, lemons, and lot of different fruits that are actually in citrus in nature. So citrus fruits having vitamin C, okay, green vegetables, tomatoes, and human milk. These are the different sources of the vitamin C. Okay, if we discuss the different properties of the vitamin C, so vitamin C is actually the water soluble. There are actually two water soluble vitamin, and that is B and the C. And in the B you will see the B1, B6, and lot of B7 and lot of different B complex, and vitamin C. Basically these are water soluble vitamin that can easily excreted from our body. And vitamin C is actually white crystalline in nature, odorless and sour in taste. So the question is, citrus fruits are actually sour in taste, that's good, but green vegetables and human milk are not sour. So actually the composition of the milk and the green vegetables decrease the sourness or the citrusness of these compounds and these things. So that's very much important. So vitamin C easily destroyed by the different things. If you see the heat is provided to the vitamin C, then vitamin C easily destroyed. Okay. Oxidation also destroy the vitamin C. Exposure to the air, that also vulnerable, that also cause the destructions of the vitamin C. And alkalis means bases, like acid base. So bases also destroy the vitamin C. So in that condition, when there is a person who takes food having vitamin C, if the stomach of that person do not produce any acid, and that condition is called achlorhydria, in which the stomach acid is not produced, that is HCl. Then in that situation acid is not properly produced, and after that when the food moves downward, then in the duodenum pancreatic secretion and the liver secretion come, and that are actually alkali in nature. So that's alkali secretion destroy the vitamin C. In only that what condition? Achlorhydria, because alkalis destroy the vitamin C. Okay, if we discuss the different function, vitamin C has a lot of function. We discuss it one by one. So first of all, if we see that the most important function is hydroxylation. So collagen, that is the most important protein in our body, and that is present in abundant amount in our body. Okay, lot of structures have collagens, like it is actually present in the connective tissue. Connective tissue have lot of collagen, like bones, blood, and cartilage, and different tendons. These are basically the connective tissue. In the connective tissue you will see the lot of collagen. Collagens are basically the fibrous proteins, okay, that are actually present in the connective tissue. Okay, so what actually the role of the vitamin C in the formation or in the stability of the collagen? So collagen are actually the proteins, and as we know that the proteins are made up of amino acid. So lot of amino acid combines, and after that here are basically the different amino acid. Lot of different amino acid attach, and you will see the formations of the proteins, and collagen is actually the protein. So two most important amino acid, proline and lysine. Proline get hydrolyzed, hydroxyproline. Lysine also become hydroxyproline, through the process that is hydroxylation. You will see in the hydroxylation, you will see the just addition of the hydroxyl group to the amino acid, and that amino acid present in the collagen. Okay. So enzyme, in the enzyme you will see the hydroxylase enzyme. Hydroxylase enzyme actually involved in the conversion of the proline to hydroxyproline, lysine to hydroxylysine. Okay. In this process, so actually hydrolase utilize the iron. Okay, that's important things. In the form of Fe2 positive and F, it will become Fe3 positive. In this reaction, iron is utilized in the form of ferrous form, Fe2 form. And after the reaction, you will see the iron will become the Fe3 form. That is actually the ferric form. Okay. Now again, this reaction require again the Fe2 positive. So now this Fe3 positive has to be again converted into the Fe2 form with the help of the ascorbic acid. Ascorbic acid. Ascorbic acid, which is actually the vitamin C, convert the Fe3 into the Fe2. And now in the conversion, ascorbic acid will become dehydroascorbic acid. That's very much important. That is the most important process. So after that, when the hydroxyproline and hydroxylysine form, okay, here are basically different strands of the collagens. Here are basically the, if I write it here, different strands. So actually you will see additions of the OH group to the different sides of the collagen. Now this hydroxyl group will form a cross link, and after forming cross linking between the different strands of the collagen will become stabilized. If there is no ascorbic acid, then the whole process will not happen, and ultimately there is no hydroxyproline, there is no hydroxylysine, and ultimately the stability of the collagen will disturb, and ultimately it will affect the connective tissues like the different bones, cartilage, bloods, and the tendons. So that's very much important. This is actually the one function of the ascorbic acid, is to stabilize the collagen. Next is the formation of the norepinephrine. Okay, dopamine convert into the non-epinephrine with the help of the enzyme, and that is dopamine hydroxylase enzyme. In the presence of the vitamin C, or you can say ascorbic acid. Ascorbic acid is also important, and after that non-epinephrine can be converted into the epinephrine. So these are basically the second, this is actually the second function of the ascorbic acid. Next is the methemoglobin. What is, there is a difference between the normal hemoglobin and the methemoglobin. In the methemoglobin, the iron is actually present in the ferric form. But in the normal hemoglobin, iron is actually present in the ferrous form. So now vitamin C can be used in the convergence of the methemoglobin into the normal hemoglobin. So that's why in the treatment of the methemoglobinemia, we use the vitamin C, or you can say ascorbic acid. So this is a third function. Next is the steroid hormone. In the steroid hormone synthesis, vitamins also play an important role in the adrenal cortex and the corpus luteum. These are basically the important hormone. Adrenal cortex, that is actually that gland actually present above the kidney, and corpus luteum that actually act as a hormone that is actually present in the ovary. So they are actually in these gland, you will see the redox reaction in which vitamin C is utilized, and you will see the synthesis of the different steroid hormone. Okay, after next is the folic acid converted into the tetrahydrofolate. Folic acid converted into the tetrahydrofolate. After that, it will absorb into the body, and they are actually involved in the different process like the maturations of the RBCs. So it's mean that the vitamin C also play an important role in this conversion. If there is no vitamin C, then there is no tetrahydrofolate, and it will not utilize in the body in this maturation of the RBCs, and lot of different cell in the divisions of the cell. Okay. After that, absorption. Vitamin C in the food, iron in the food present in Fe3 form. For the absorptions of the iron, iron should be in the ferrous form, Fe2 form, otherwise iron will not absorb. So first of all, iron will convert into the Fe3 to Fe2 form. Now this Fe2 form will easily absorb into the blood stream. Here is the blood stream. Now this Fe2 form will easily be absorbed into the blood stream. Otherwise, iron Fe3 has difficulty in its absorption. Okay. Next is the vitamin C is actually involved in the preventions of the chronic diseases like cancer and the heart diseases, coronary heart diseases. Why? Because free radical, oxygen derived free radicals like if I say superoxide, peroxide, hydrogen peroxide, hydroxide like O2 negative and H2O2. Free radical causes lot of different diseases like cancer, lung disease, heart disease, anti-aging. So now free radical has to be removed or inactivate. So vitamin C is very much important in the antioxidant. It will work as an antioxidant. Okay, it will remove the free radical. So vitamin C and other vitamin as well, vitamin E and the beta carotene. So these are basically the three most important components that actually work as antioxidant. Okay, or you can say anti-aging agent. So these are basically the how vitamin C prevent the chronic diseases. Next, when you see the deficiency of the vitamin C, you will see the disease that is very much important, and that is called scurvy. In the infant who doesn't feed on the breast milk, the most of the chances of the developing the infertile scurvy, or you can say molar Barlow disease. Okay, that is specifically in case of infants. So the most important system that will be related to the bones is, first one is the arthralgia, that is the pain of the joints. Next is the tooth formation, that will be impaired tooth formation. So actually there are first component of the tooth is enamel, second is the dentine, and last is the pulp. So the dentine is mostly affected when you see the vitamin C deficiency. Okay. Next is the frog-like positions of the legs in case of infants. In that situation, the legs become abduct and flexed. Okay, that is in case of, because bones, structures of the bones will become weak. Okay. Next is the blood vessel. So actually, you will see, as we know that the endothelium, the blood vessel is form of endothelium, and the endothelium combined with the help of the ground substance. So in the formations of the ground substance, vitamin C is very much important, and there is no vitamin C, then the stability of the blood vessel will become weak and the blood vessel easily rupture and you see the bleeding. And next is the anemia. So in that situation, as we know that the folic acid deficiency, you will see the tetrahydrofolate deficiency, that is the most important cause of megaloblastic anemia. Okay. Next is the connective tissues. So wound healing will take long time when you see the vitamin C deficiency. Okay, and you also see the gum bleeding in the gum, and you can also see the gangrene in the mouth. So these are basically the different symptoms of the vitamin C deficiency. If you still have any question, you may ask in the comment section. Thank you so much.